Hey, I am Divyah from Group 25. Today I'll be talking about caring for patients who had nephrostomy. What is nephrostomy? Nephrostomy is an opening that is made between the kidney and also the skin on your back. It lets urine drain out from the kidney. So there is a thin, flexible tube catheter goes through the opening into your kidney, usually in the back part of the area. So this is called a nephrostomy tube. So urine drains through that tube into a bag which will be outside in the external segment of your body. It will be outside. It will be attached. The bag has a tape so that you can empty it, and you may still pass some urine in a normal way even when you have nephrostomy actually. So what are the causes? What leads to having a nephrostomy? The factor is patient with cancer or patient with any blockage when it comes to in their urinary system, when it comes to passage of urine being disrupted. Hence, a nephrostomy is used to aid them to release, to excrete their urine in a more external, more surgical way. So that is how nephrostomy helps. So you may also need nephrostomy if there is cancer or as a cancer treatment that affects that one or both ureters. And if a ureters become blocked, urine cannot flow from the kidney to the bladder. So that is also one of the factors. And also this causes urine to build up in your kidney. So when this happens, kidney sometimes may slowly stop working. So if it is not treated quickly, it will make you feel very ill, very unwell. So you may need one nephrostomy tube when it comes to this kind of situation, depending on whether both ureters are blocked or one ureters are blocked, depending on the emergency, depending on the situation. So how many types of nephrostomies are there? There are two types based on the number of ureters that are blocked. So for example, if there's only one ureter that is blocked, usually a unilateral nephrostomy is done. So when it comes to both ureters being blocked, both sides, there will be separate nephrostomies. So there will be a bilateral nephrostomy. So there are two types, unilateral nephrostomy and also bilateral nephrostomy. So let's jump right in on how to care for patients with nephrostomy tube bags.
First, start with explaining the procedure and asking for the patient's consent. Remove the old dressing and examine the site for any infection, redness, bleeding. Clean the area with soap and water and then with a dry pad. Next, place a gauze below the tube to prevent any skin irritation and then put on a new dressing. Make sure the dressing is secure. Remove the tube from the old nephrostomy bag and dispose the old nephrostomy bag. Clean the top opening with alcohol. Next, we will be doing a flush. A flush is needed to detect any blockage that blocks the urine flow. Use saline water for this. Replace with a new bag. Place it below drainage site and make sure patient is comfortable.